coming up. It's a pain in your groin that could be life-threatening. Find out what it is and if surgery is required after the break.
Coming up next.
Any clue what's behind this closed door?
A simple fix for a very common condition that could be affecting you.
Many people think, well, if it's not bothering you, don't worry about it. The problem is, when it bothers you, it's sometimes too late.
Today we're covering all the health problems you usually keep behind closed doors until now. And Dr. Orden and I are here in our exam room. We're about to open our next door, Dr.
May I have the honors, Your Honor?
Absolutely, sir.
All right. What is this?
I think we're going to have to ask the audience. Any clue what's behind this closed door? Can you all see this? Any ideas what we're about to share with you? This is more so something you keep behind clothes. It's a hernia.
Look how cool that is.
And a hernia is quite simply, when you're talking about an abdominal hernia, you're talking about a weakness in the abdominal muscle wall where your intestines can literally protrude through that, and it creates a bulge that in some cases can become dangerous. And the bulge can become dangerous, particularly when you can't get it back in, because it can become what's known as incarcerated, where it's stuck, and then it doesn't get blood flow, at which point you call it strangulated. It can become a true medical emergency.
And in this case, we have an inguinal hernia, right? Because it's down here in the groin area, but you can have a hernia anywhere in the weakness of the abdominal wall or around your belly button, so-called umbilical hernia.
The reason we're talking about it is because it's very easy to just hide it underneath your clothes. And Cheryl has this exact problem that she's been keeping behind closed doors.
I've always been physically active, and I love exercising. I love yoga, and Pilates, sculpt works. Probably about 8 months ago, I noticed the lump. It is right between, and kind of in the crease of my leg and the groin. And I actually thought maybe I had some kind of a cancer or something. It actually was very scary. I noticed it when it was more active and did more strenuous things, that it would protrude more. So I went to the doctor and he said, this is a hernia. And it just got to the point where it was not going away. I'd lay down and push it in and it would pop right back out. And it was pretty gross. It's kind of embarrassing to me. I haven't been to the gym in 2 months because as it did start protruding, that pain kind of increased. And then when I went to see the surgeon, I was like, okay, this needs to be taken care of so I can kind of live normally. I feel like my life is on hold. I really look forward to this being over with the surgery because I'm 53 and I don't want anything slowing me down. I can't wait till I'm like new.
And Cheryl went to see my colleague, Dr. Daniel Marcus, at the Rock Center in Beverly Hills. They were kind enough to give us a sneak peek into the operating room during her hernia surgery. Let's see how it went.
A hernia is just a weakness in the muscle. The most common places in the groin we call an inguinal hernia. We're going to reduce what's bulging out there. Then we're going to cover it with some mesh. So the traditional way of fixing a hernia would be through a large incision. Today we can do through small incisions, what's called minimally invasive or keyhole surgery. What Cheryl has is an inguinal hernia. Mark out hernia, and this is where our target is. So the first thing we're going to do is get access in the small incision. The scope is now placed inside the balloon, opens up a space in the abdomen. These little tubes are called trocars, and this is what we use our laparoscopic instruments through. And here we can see the hernia. This tissue right here is bulging forward. There it is, me pushing it back. If I let go, it bulges. So we're going to reduce that a little bit. So now that we've reduced the hernia, now we're ready to put our mesh in. So we're going to insert this, and we'll put in some absorbable screws that'll disappear in just a couple of months. And the gas will now close that space, and you can see right now the lining of the abdomen falling onto the mesh. And so now you can see that the bulge that she had prior is completely gone, and we're left with very tiny incisions, and then that's it.
And we are here with General Surgeon Dr. Daniel Marcus and his patient Cheryl. Welcome. Thanks for being here, and thanks for sharing this sort of embarrassing problem.
Thank you very much for having me.
How are you feeling now post-op?
I'm feeling great. Back to working out, doing yoga, and everything's great.
And the reality of most hernias is if you are exerting yourself, there's any increase in intra-abdominal pressure, the hernia is going to bulge even more. Right. Certain yoga poses I can only imagine, but when you take someone like Cheryl and say, you know what, it's time to do an operation to fix this.
And many people think, well, if it's not bothering you, don't worry about it. The problem is when it bothers you, it's sometimes too late. And then you need emergency surgery, and then you have to still deal with the hernia later. So I think it really should be dealt with. It's nothing that you have to go to the emergency room right away. You can push a hernia back in if it's small, but if there's any resistance, you should avoid doing that, and you should go see a doctor right away. So now, laparoscopically, we can go with just 3 small, tiny incisions rather than avoid any of the large incision, and you're out in a couple of hours. A significant improvement.
Well, Dr. Marcus, thank you for sharing. Cheryl, thank you as well. And hey, if you do have a hernia, when it becomes a true emergency is if you can't get that hernia reduced, pushed back in, it's starting to get more and more painful. It can lead to bowel obstruction or even bowel wall death. That's when it becomes a true emergency, so make sure you get it looked at. Coming up, a young couple opens the door for help with a problem that's making it very difficult for them to have a baby. Stay tuned.